In this session, we will see the difference between experimental and observational studies. So, what is an experimental study? So, the study designs can be divided into experimental and observational studies. Experimental studies are also called as interventional studies, and observational studies are also known as non-interventional studies. So, how do we decide whether it is an interventional, experimental or observational study? So, one of the question is, does the investigator decide the exposure? For example, the exposure of a drug. Let's say we have a study going on COVID, coronavirus, and then there is a new vaccination, and the investigator decides to create two cohorts, two groups. To one group he gives the new vaccine, and for the other group he doesn't give any vaccine. That's a placebo or a control group. So for one group that is receiving a vaccination, that will be called as a treatment group, and the group that is not receiving any intervention, or in other words, the group that is not receiving the vaccination, is called the control group. So in this scenario, the investigator decides who gets which of the subjects gets COVID vaccination and which of them do not get a COVID vaccination. So the exposure to COVID vaccination is decided by the investigator. In those scenarios, it is called as experimental study, because the investigator decides which cohort or which group of subjects receives the drug and which do not receive the drug. On the other hand, let's look at an example for observational study or a non-interventional study. So considering an example for observational study, so let's say a scientist, he wants to know whether COVID vaccination is really helping patients develop or helping people develop immunity to coronavirus. So he retrieves the data from various hospital data warehouses. So let's say we have data from various hospitals, so he collects the data and he creates two groups, two cohorts. One cohort are those who are vaccinated, and there is a second cohort that those who didn't receive a vaccination. And let's say he follows them over a period of time. After 6 months of follow-up, he looks at the data and sees if there is a significant difference in the COVID cases between the two groups. That is, the group that receives a COVID vaccination and the group that doesn't receive a COVID vaccination. So he is interested to know whether COVID vaccination is really helping people develop immunity to coronavirus. So if there are more number of cases in the non-vaccinated group and there are very, very few cases in the vaccinated group, then we can see that there is a really significant difference between the two groups. In other words, the COVID vaccination is really helping people to develop immunity to the virus. So in this scenario, the investigator or the scientist who did the study did not decide who is going to be exposed to COVID vaccination and who are not going to be exposed to COVID vaccination. So these subjects are self-selected. So the people themselves decide whether they want to get vaccination or they do not want to get vaccination. It is not decided by the investigator or the scientist. The scientist or the investigator just follows the people over a period of time, the vaccinated and the non-vaccinated group, and checks the number of cases in each group. So because the scientist is not deciding the exposure of subjects to COVID vaccination, this is a observational study or a non-interventional study, because the exposure to COVID vaccination is not decided by the investigator of the study. So that is the difference between an experimental study and an observational study. Experimental study is also called as interventional study, and the observational study is also called as non-interventional study. And there is one more aspect of experimental study designs. There are studies, most of the studies do have randomization, because randomized controlled trials are considered the gold standard, are considered as the of highest standard in understanding a causal relationship between the independent and the dependent variables. On the other hand, when we look at the non-randomized studies, there is no random assignment. So the difference is that in the randomized controlled trial, the subjects are randomly assigned to treatment groups. So let's say one group receives a drug for COVID, and the other group doesn't receive a drug for COVID. The investigator is creating two cohorts, and he takes, let's say, 100 subjects and randomly assigns 50 to the group that receives a treatment for COVID, and the second group that doesn't receive a treatment. The investigator, when he randomly assigns subjects, randomly means it's not a systematic way. So he just like a tossing of a coin, we toss a coin head and tail. So just like that, it's a randomly we get a head or a tail. Just like that, we are randomly assigning people to groups. So there is no systematic manner in which the patients or the subjects are assigned to cohorts. So that is what is random assignment. So we will focus on these aspects. And why do we do a random assignment? It's because the purpose of randomization is to avoid investigator bias. Investigator bias in the sense the investigator may have a sense of bias when he is doing a study, and we do not want that bias to affect the results of the study. In other words, whenever we do a study, we really want to prove that there is a significant improvement. Like if we are having a new drug, we want to prove that the drug is really effective in treating a particular disease. And naturally, we may tend to assign people who are more likely to help in proving our case in a particular treatment group. So in order to avoid such a bias, we are ensuring that subjects are randomly assigned to groups, whether it is a treatment group or whether it is a control group. Control group that doesn't receive a drug, and a treatment group that receives a drug, so that the groups are comparable. We can compare the groups. We will see an example of a random assignment. So in this scenario, you can see we have a couple of subjects, patients here, who are randomly assigned to treatment group and control group. So 5 patients are assigned to treatment group and 5 are in control group. They are followed after some time, that is, they are followed up for a period of time, and again they are measured for a particular variable. For the dependent variable, they will check what's the difference. So imagine we are having 10 patients, and we would like to see whether there is a let's say we want to see the effect of meditation over anxiety disorders in people. And we have 10 patients, and we assign 5 to meditation group, that is treatment group, and 5 to control group, that doesn't receive any meditation intervention. Then we follow them over a period of time, and let's say after 6 months of follow, we go and test them again. We look at their anxiety parameters. Initially we would have tested them already after assignment to group, and after 6 months, let's say we test them again, and we see whether there is a significant difference between the two groups with respect to reduction in anxiety. So that is how random assignment works. So we randomly assign subjects to the groups, and we follow them over a period of time, and then we do a test whether there is a significant difference between the groups. So this is all about the two study designs, observational study and the experimental study. Thank you.